Joining us now is our Dr. Jon LaPook. Jon, good morning.
Morning.
This is now the second high-profile suicide this week, and just hear everyone saying, wow, what is going on here? We just had this new study that says suicide rates are up. What's happening?
They're up 25% in the last decade, and a lot of very smart people are looking at this and saying it's multifactorial. We don't really understand why there's such an increase. The risk factors are things like social isolation, if you're in trouble in terms of alcohol abuse or drug abuse, of course, a history of depression or previous suicide, or even family history of suicide. But one of the things that we keep coming back to when these surprising events happen is you never know what is in somebody's head. And so how do you know? A lot of times people who end up committing suicide, even when they're asked, are you suicidal? They'll say, no, I'm not.
Would you consider this a public health crisis? And if so, what does that mean exactly in terms of the way we should think about this?
I think it is a public health crisis. And I think what it means is that we need more resources. We need more research. When you have something that's increasing and smart people are looking at it and saying, what is going on here? You know, there's no obvious, we know that when there's mosquito seasons, you get more mosquito bites. But what is going on here to cause this increase? And we do have a society, we have to all say, where there is apparently more social isolation.
Yeah.
And this, one of the things that is so tragic, and people beat themselves up about it, is this can be such an impetuous event.
One of the things in the CDC report that came out yesterday, I read through it, it said that in more than half of deaths in 27 states, the people had no known mental health condition when they ended their lives.
Right.
Is it that perhaps they should have been seeking treatment and they weren't, that maybe more people need preventative care? Preventive
care and more outreach. Doctors, I think, have been criticized because we don't go into that. If somebody may have 15 minutes for a visit, and the doctor may be the one person who really knows you for all those years, and the person really trusts you. Go into it. There are questions that you can ask to try to elicit it. But it's a very tough thing when studies show that often people will deny it. We do have to say that guns accounted for about half of the 45,000 deaths. It can be an impetuous event that if you can just get over it and then get treatment, that maybe you can try to avoid it and get some help.
Doc, warning signs. I mean, what are the indicators? What should people be looking for?
Yeah, and that is what people kick themselves afterwards when there were no apparent warning signs. But the ones that are written about are social isolation, engaging in risky behavior. So drug use, alcohol use, a history of not only depression but suicidal ideation, saying not only am I kind of thinking about suicide, but here's how I'm going to do it. A family history of it also.
And just quickly, you're an internist. You see patients.
Oh, yeah.
Do you hear more people saying, I'm suffering from depression and anxiety?
I certainly hear people saying they're more anxious in recent years. And yes, with depression, I'm very aggressive with this. I actually spend a bunch of time talking to people. It's usually towards the end when they're feeling more comfortable. And I'm going, how's it going? And all along, I'm sort of probing and finding out what their mood is. And I refer very, very often to psychiatrists, other health facilities to try to get people mental health. And also I try to say to them, look, I'm here. I may be the only person in the world who you feel comfortable talking to. And there was some statistic, I may get it slightly wrong, that said that people who had committed suicide, about half of them had seen a doctor within the previous 6 or 12 months. Wow. And so I think of myself like I may be that lifeline. I may be that
last line of defense.
Who they feel comfortable. And I'll say, look, it's you and me. I promise you, there's no judgment. Tell me everything.
Thank you, Dr. Jon LaPook.
Thanks.
Thank you.